We are glad to host you all for today's Project Stellar information session on peer-to-peer learning. With us here are a number of countries, both mentor and mentee countries, who will be sharing with us some experiences and lessons. So for you to follow up on the meeting presentation, there's language translation services available. Please click on the interpretation button to select the right language, English, French, as well as Portuguese translation. With that, I would want to welcome for opening remarks, which will be provided by our colleague Maria Kirova, the head of High Impact Africa One at the Global Fund. Maria, please, over to you and welcome.
Thanks a lot, Osborne. I hope you can hear me well.
Yes, we can hear you well. Go ahead.
Excellent. I'm very pleased to join today's information session on Project Stellar peer-to-peer learning. It's a big pleasure also to share a warm welcome to the esteemed countries' ministries of health, to the principal recipients representatives, to the implementing partners from numerous countries, and certainly to our Global Fund colleagues. I'm excited that we have our online forum today, because we are going to take stock of a journey. It's a journey that started in 2022 under Project Stellar, with the initial focus on emergency response under pandemic circumstances. The initial focus was on COVID-19 response. And then, as we have been working hand in hand and treading the same path forward, the Project Stellar has actually evolved and redeployed the resources, the expertise, our joint space to focus on, to move from emergency response to strengthening the integrated laboratory systems core capabilities. And I think that there is a distinctive feature of this project that all of us hold very dearly to our hearts. That is the peer-to-peer learning platform and methodology. Essentially, the peer-to-peer learning, it aims to support the knowledge transfer in a sustainable way, as well as institutionalize the proven best practices and good innovative solutions for integrated laboratory systems, which is shared within a group of peers. This is an initiative where really the Secretariat joined hands across different teams, including our RSSH laboratory team, represented by Osborne, Grant Management Division, where I have the privilege to serve the organizational mission, as well as the IT country support team. So essentially, Project Stellar, from our perspective, also marked a shift in the way we work together. There is a shift of moving the technical assistance provision from external providers in different capacities and different geographies. We actually firmly and steadily shifted it to countries from Africa with strong capacities, with strong expertise, with strong experience within specific designated laboratory focus areas. And then we have the ambition, our ambition together was to learn from within the continent to accelerate the implementation of integrated laboratory system strengthening investments. So that was a big undertaking. Started during pandemic times, and then gradually all of us working together to reshape it with a more system strengthening lens. So we have 21 mentee countries in scope from the African region. They have been key pillar to the initiative, and I really would like to request you to join me and applaud Uganda, Zimbabwe, and Rwanda for providing a supportive training environment for the mentee countries. And the laboratory directors of the ministries of health have been a key essential ally in coordinating the country-driven technical assistance for ownership, which from us is also an illustration of the Global Fund's commitment to country-driven technical assistance. So during today's session, we're looking forward to hearing feedback and sharing experiences from a few countries, specifically Ghana, Uganda, Zimbabwe, and Zambia, and hear from them on their experience and how they are applying the lessons learned in driving implementation and innovation on the ambitious laboratory system strengthening agenda. Looking forward to the discussion. Thank you. Back to you, Osborne.
Thank you so much, Maria. You have done quite great justice to our agenda for today, and we have the full trust in the ability of this team to deliver on the core mandate of this technical assistance opportunity. So shortly we'll have our presenters taking the floor. I would encourage all attendees to kindly type in your name and the country you represent on the chat box. Secondly, we will be running through the presentations mode back to back. So we would welcome any questions or comments you have. Kindly type them on the chat box. Then we'll have a moment for questions and answers at the end of the presentations to allow more room for discussions and engagement. So with that, I want to welcome the Uganda team under the able leadership of Dr. Susan Nabada, who will be walking us through the presentation on the mentorship opportunity on external quality proficiency programs, as well as equipment management that has been supporting quite a number of mentee countries. Susan, over to you.
Thank you so much, Osborne, and we are delighted as Uganda to give our experience on the peer-to-peer trainings that we've been having, but allow me to thank Global Fund for this great initiative they came up with of using our own in-country capacities to support each other in the region. So we are glad to present the Ugandan aspect where we're supporting building capacity and sustainability of quality lab systems through PT production and equipment maintenance. Next. So it's all around health laboratory system strengthening, and these are the different systems in the lab that we support as the laboratory directorate in the country. And we are glad that Global Fund chose Uganda to support in the area of equipment maintenance and calibration and the external quality assurance system, but all these other systems, safety, information, supply chain, sample transport, are all areas that we support within the country. But our main focus today is equipment maintenance and calibration. Next. So this peer-to-peer approach that the innovation that Global Fund came up with was in an approach where we're facilitating individual training that we think, as we are going to hear, translated into a national impact by getting engagement with the individuals, making sure we sustain the contact between the individuals as they are learning, and what they learn, we make sure that as they go back, they apply them to their countries, get a change. And I'm glad that we are presenting as the mentor countries, and we are going to hear the mentee countries if they actually have created any change. Next. So the general objective for the systems that for the peer-to-peer learning in strengthening integrated lab systems is to make sure that the institutions are strengthened towards having sustainable lab systems and diagnostic networks, but also mainly to leverage on the established regional capacity, as you've had, to promote peer-to-peer learning, training models to enhance, make sure that the funds that we apply for through different grants are absorbed and we implement them so that we can have an impact. But above all, to limit reliance on the international TA. And the leadership trainings that have been provided helped in the development of complementing the technical skills and enhancing performance. So for Uganda, we were given a task to build capacity in EQA and PT panel production intervention, mainly in malaria RRDT, but we went beyond just MRDT. And we had 3 cohorts with the different cohorts, different countries: Ethiopia, Zambia, Tanzania, Zimbabwe, Kenya, Sierra Leone, as you see them listed up. Unfortunately, we didn't get DRC coming up because of the approval processes in the country, but also for equipment, we had also countries from Cameroon, mentees from Cameroon, Mali, Liberia, Tanzania, South Sudan, and ourselves as Uganda. Next. So what we did was we involved, the individuals were involved, and we had peer-to-peer learning where we had exchange of knowledge and experience from the different mentees that were being trained. And in this way, after the exchange of knowledge, we had then diffuse learning, and after that, we expected that this diffuse learning, that the mentees would go back to their organizations to make sure that what they've learned is impacted back home. And as a follow-on, these are some of the things that we shall be following through. So we had the engagements, we sustained the peer engagements directly with the mentees, and we actually encouraged and fostered actual peer learning. And we expected that after this, the learning will be cascaded back, and then we will get impact as we go to visit these different countries. Next. So for the objectives of the EQA and equipment peer training, we wanted to share the knowledge and best practices on how you can establish a national proficiency testing program through peer-to-peer learning using our department here in Uganda. But also on the side of equipment management was to equip participants with knowledge of equipment maintenance and calibration. Specifically, what did the mentees learn? We really built capacity on production and management of the different PT schemes that we have in the country. We have over 16 PT schemes that have been accredited for the essential diagnostic services. But the main emphasis for this peer-to-peer learning was on the malaria RRDTs. As you all know, that we've not been having panels for the malaria RRDTs, yet we know we are using RRDTs up to the lowest level of care, so we needed to control quality. Then we also gave technical assistance and mentorship on PT implementation at the same time. And we also, on the side of equipment maintenance, we were able to give the general understanding of the ISO 17025, the 2017 standard, and equipping our participants with basics on uncertainty in measurements, and also making sure they are able to maintain and calibrate in terms of volumes, mass, and condition chambers. So these are part of the participants that were in the calibration center, and also trying to being shown on how you can calibrate. We also went beyond what the areas they wanted, and also talked about the biosafety certification of the biosafety cabinets. Next. So what did we actually do? In the actual peer learning phase, we had site visits. The mentees visited sites. We had face-to-face connections. As you can see, the members were directly having contact. We also had some few virtual meetings for the sites that we couldn't visit, but also we had joint peer activities. And as we were training them, we used a combination of methods. We had didactic lectures, interactive discussions, the field visits, as you will see, then the group exercises. But above all, we had a hands-on practical session such that we enhanced the learning, such that they can be able to transfer this back to the countries as they go back. For the EQA production, the individuals visited the EQA production lab. They did all the trainings in the lab, and they managed also to go and visit the sites where we take the EQA, the panels, to follow through that whole cascade until when the results are returned and then corrective action is done. For the side of the equipment maintenance, there was formal knowledge sharing and training and hands-on skilling to make sure they grasped all the different concepts in equipment maintenance. Next, those are some of the pictures when the teams were in the different labs. So the innovations that we used and we saw that worked were, one, we had practical sessions and we provided an opportunity for hands-on experience, and we're telling them to do it themselves, as you can see, colleague from Senegal there in the EQA lab. So we used the do-it-yourself approach that enabled a better understanding of the techniques themselves, practical use of the equipment that we had, and application of the various techniques using the available resources. So we allowed the mentees to do it themselves. And then after that, for example, as you can see in that picture, after producing the panels, they were able to follow through to they visited the sites where the panels are dispatched to learn the involvement and the roles of the other stakeholders in the PT cycle, how we transport the samples, the information management, and the support between the hub and the spokes. And the panels prepared by the participants transported and were tested at the lab, and the results were uploaded on the QA dashboard. All this was done by themselves. So we really we used the do-it-yourself approach, and we saw it work. Next. Next, sorry. Then the other innovation that we saw that worked was the open discussion that we used in the peer-to-peer learning model, where we provided an opportunity for the countries to share experiences and practices from their different backgrounds to make sure that we take into consideration what they are doing such that they can be able to change or improve when they go back. But above all, we created groups, WhatsApp groups for them to keep boosting their knowledge exchange, is communication, and is real-time follow-up for any issues that they would come up with. Next.
Dr. Susan, I request if you could hurry up a bit in the interest of time. Thanks.
Yeah, these are the last slides. So this is the MRDT EQA action progress that we have. All the countries that we had presented their training reports. Knowledge transfer has been done to some of the countries. In some of the countries, as you can see, what is shown here, Zambia and Tanzania. Some have developed document guidelines, but we've also noted that some countries have not yet done anything. But these are the measures that we have, the indicators that we follow through after the peer-to-peer when we go back down. So this is a snapshot of where the countries are post-training, post having the peer-to-peer training. That's for MRDT, and the next one is for equipment. Can we just spread the next one? So this is also the equipment. They're doing well. Most of the indicators are being met, so we shall follow through when we get back to the countries. So what are the next steps after the trainings? Next, the last slide. So the outcome of this, we've had 28 individuals from the 10 countries trained on EQA, 21 individuals in equipment maintenance. We've had all countries sharing their work plans, and some countries have also started on training and developing documents in their countries. And some, as you'll hear, have scaled up production and distribution and management of EQA panels and the management of equipment to ensure continuity of testing. So we are following up, and we are going to follow up in these mentee countries to see the progress, and we will keep supporting them. So this is a snapshot of how we engaged our trainings. We had the top leadership of Ministry of Health part of this for ownership, and we had our Minister of Health and the PS present to officiate some of our trainings. So briefly, that is how Uganda supported in the peer-to-peer learning. Thank you so much.
Thank you so much, Susan, for that very wonderful presentation elaborating Uganda's approach to the mentorship program. With that, I would want to welcome Agrippa Mtambara, the lead for the Integrated Sample Referral Network in Zimbabwe, working with the Ministry of Health, and they will be walking us through the mentorship approach by Zimbabwe. To all participants, please feel free to type in any questions or comments you have on the chat box. There will be time for discussions, questions and answers. Thank you.
Thank you, Osborne, and good afternoon, everyone. Kindly confirm if you can hear me.
Yes, we can hear you loud and clear. Please proceed.
Thank you. I'll just share the Zimbabwean experience in as far as specimen referral systems is concerned. Just
Agrippa, we are losing you. We can't hear you.
That visited. And the second cohort was for the French speaking and Portuguese. We had a total of 21 participants with 3 participants from each country. And approach where weeks of the peer-to-peer interaction. And week 1 was characterized by 2 sessions. One, we had a meeting session where we had to understand context. So before the peer-to-peer interactions, we developed templates for data collection, country assessments, and so forth. So we shared with the countries before they came in, and we collected certain pieces of data before they came in. So on our first day, we had data interaction where we are trying to understand country context in terms of specimen referral systems. And following that, we went to the field to have an appreciation of what is actually happening on the field in as far as specimen referral systems is concerned. And our approach as Zimbabwe is we have our system health and child care. So we visited.
Agrippa, can you kindly check on your internet connection? It is coming on and off. Thanks.
No, I think someone was trying to call my on my mobile. That's why it is a bit unstable, but I think it's stable now. So I was saying we visited one of our regions in the country where we're appreciating services that are being offered through sample referral systems. And we visited that region starting from the primary care facilities up to the provincial or the referral level, appreciating how our samples move from that level up to the highest referral level within the province, and how the MOH is taking a lead in making sure that the sample referral system is operating well. So this was our approach for week 1. And for week 2, next slide. Week 2, this was more for conferencing and capacity building, sharing experiences, and also development of the work plans. So during this week, we had a time where we're sharing our full-scale program, how we have started it, how we managed to have stakeholder buy-in, issues of application for funding, program ownership, management, governance, fleet management, sustainability, program oversight, and also a bit of the challenges that we are actually experiencing. We're also looking at issues of managing data, the monitoring and evaluation indicators. Then we went on to then develop country-specific plans. Looking at what we are doing, we're not giving a prescription, but we're just sharing all out in terms of what we are doing. And mentee countries were also sharing their experiences where they are, and we're also learning some important steps from what the mentee countries are also offering. So we had a knowledge exchange within the 2 weeks, but we ended up having plans for each of the countries in terms of what they're going to do post the peer learning period. Next slide. These were our experiences. We managed to have knowledge exchange, like I indicated before. We managed to understand different country contexts in terms of sample transportation. Some are using private courier, some are using it's fragmented, some have got challenges in terms of the size, terrain, and so forth in their countries. So we were different experiences that we were learning from all these countries. Then what we then picked up is all the mentee countries, they have a specimen transportation system in place, but all of them, they are characterized by parallel approach fragmentation. So this is something that we discovered that these countries or our mentee countries, they're actually struggling with this. And their main question was how did Zimbabwe then manage to integrate all this? Because our system is so integrated, it transports any specimen, whether it be routine or disease specific or even outbreak specimens. And we also found out that most of the transportation systems within the mentee countries, they are not engraved into the MOH systems, just like we are. So we had time to exchange on how we've done it and managed to succeed. We also discovered that some of the countries, they already had good funding for specimen referral. And this exercise was to help them to then absorb that funding and put it to good use. So it was quite an important experience for both ourselves as a country and the mentee countries. Next slide. Next slide. Let's move to the next slide, please. Right. What were the key outcomes? Enhanced knowledge sharing, I think I've already talked about that. Participants gained valuable insights into specimen referral best practices and challenges faced by other countries. They also managed to appreciate what other countries are going through and what others are facing. Strengthened collaboration. The event fostered collaboration amongst participating countries. You find that at the end of the 2 weeks, we had quite a lot of collaboration that was going on, knowledge sharing and so forth. We also managed to then identify capacity building needs for each country, because when we then reviewed the plans, we found out that the mentee countries, they were actually focusing their plans on those areas where they needed to build capacity on. And of course, all the 7 mentee countries, they managed to develop actionable plans. Next slide. Challenges, right? Some of the countries, they felt, well, they had nothing much to learn. Because they felt that their systems were okay. But I'm happy that at the end of the peer-to-peer learning, they also had quite a huge chunk to take away. Then for the Franco-speaking countries like the French and the Portuguese, yes, we had all our materials ready, but the issue of interpretation services, they were excellent. Interpreters within the country translating from English to both French and Portuguese, it was excellent. But translation services, they were suboptimal, where the material that we shared It was slow in coming up to, in bringing them to the respective languages. And we feel that that could have been a challenge for those countries to catch up on what was actually happening. So I think when we have future engagements, there will be an improvement around this area. Next slide. Proposals for next steps are stronger collaboration strategies for mentor and mentee countries to foster meaningful implementation of action plans. We feel the momentum that we started with during the 2-week interactive period, it's sort of like dropped. We feel maybe there need to be stronger collaboration strategies so that we maintain the tempo, we maintain the speed, we maintain the gears, so that we are able to follow up with each country, learn to know what they're doing, the challenges that they're facing, and so forth. And we also propose that to achieve that, virtual interaction meetings regularly, of course, between mentor and mentee countries, we're able to learn exactly what these countries are going through. We're also able to learn from them what we can still improve in our systems as well. And of course, exchange visits, they would make sense. Visit to mentee countries towards strengthening the implementation approach. I think this is one thing, and I think it's also on the proposals or on the cards. Next slide. Resources permitting, peer-to-peer country learning should be cascaded beyond the identified countries. Yes, they've been identified countries to say maybe these need to develop more in terms of their needs are more than the others in terms of specimen referral. But we feel the scope should actually widen, where countries exchange and have these peer-to-peer learning sessions. It actually helps improve systems a lot. That's how we feel as a country. And I think the next one should be the last slide. Next slide.
Thank you so much, Agrippa, for those very excellent presentations and for allowing your country and your sample referral model to become a learning platform for other countries. So with that, I would want to welcome the mentee countries to share with us some of the lessons learned from the peer learning exchanges and the approaches and innovations that they are adopting to support implementation going forward. So in that breath, the first presenter, I'll be welcoming the Ghana team, and this will be led by Dr. Gifty Boateng of the Ministry of Health Lab Directorate. Dr. Gifty, over to you. And I would also encourage you to please be mindful of time. Please go ahead. Gifty, we can't hear you if you are talking. Dr. Gifty, we can't hear you if you are talking. Zeoda, can you? Good. Now we can hear you. Please go ahead.
Yes, can you hear me now?
Yes, we can hear you well and clear now. Please go ahead.
Maybe we could suggest to turn off the camera and then we will have the sound because the connection is very, very bad here.
She's still muted. Maybe you need to unmute her.
Hello.
Yes, Dr. Gifty, we can hear you, though your connection is not very strong. We keep off shut down your video, then it allows more bandwidth for you to speak up.
Hello.
Yes, we can hear you. Please proceed.
Thank you very much, and sorry for the hitcher. So I'm presenting this on behalf of the country team Ghana. and our experiences that we had from Rwanda and then Zimbabwe. Next slide. Next slide, please. Yes, so to introduce the work that we did as part of efforts to strengthen our lab system systems in Ghana, Global Fund is supporting us under the CR19 and GCC. And being helped us to do. So as a result of this, there was a peer-to-peer learning experience that was organized by Global Fund through Project Stella. And then Project Stella collaborated with East Central and then Southern Africa Health Community, supported 3 nominees each for us to be in Zimbabwe and also in Rwanda. This was a 10 working day that we were there. Next slide. So what were some of the experiences? Under sample referral system, we realized that there was program ownership. So there is the Ministry of Health, there's an implementing partner, and then there are donors. But then these activities of the sample referral system that they were running, what they call as
Dr. Gifty, your sound system is coming on and dropping off. If you could check on your internet connection, that would be great.
Wow, my internet too says full internet anyway. Can you hear me now?
Yes, we can hear you well now.
Thank you. And so the other thing we also realized that it is not that they are just, the Ministry of Health is in full ownership, but again, they have full knowledge of and an understanding of the whole processes that was being
There you go, Dr. Gifty, we lost you again.
that whatever the ministry is doing, the implementing partners were also involved and they know what was happening. This was not only by mouth, but then they had a written roles and responsibilities that were well documented and everybody knows what they were doing. And it's not only at the again, they are knowledge to see what also the district realize that this ownership was seen. Next slide. Hello.
Yes, we can hear you.
Thank you. Yeah. So on sample handling and packaging, what we experienced was that they had established procedure for sample collection and then packaging, which was well documented and we could feel it. The team also had good knowledge and understanding of the procedures on how to carry them. It was not just written down, but then when we asked questions and wanted to know more, you could see that people were ready to give out what they had known. Again, the country had an excellent packaging system and they were using the triple packaging, and this was really documented and you could see it. Samples also were being monitored as they were being transported, and the temperature was also being monitored. So then if it is cold chain, you could still have the cold chain get into the testing lab in a condition that was very good. Next slide, please. Next slide, please. So we also, concerning the competency of staff that were being involved in the IST, we realized that
Dr. Gifty, we have lost you again.
See that. Hello, can you hear me?
Go on, we can hear you now.
Thank you. So the knowledge was not only in the technical team alone, but then the riders that were involved in the work were also very knowledgeable, to the extent that they knew how to observe the samples that they were being picked, and also could check for sample rejection criteria. And therefore, the data we were shown show that they had reduced sample rejection criteria to the barest minimum, because they don't just pick samples and move to the next level because they are riders, but then they had knowledge on what to pick and how to do that. Again, the lab staff who were testing also were updated regularly, and therefore they could make sure that where there are gaps between the riders and then the intermediate sessions where samples are being parceled, they also could arrange for it to be done and be done well. They also engage riders bi-weekly to address challenges. So as the IST program was being run, you could see that they are able to work together. Next slide, please. So on the issue of the equipment, that's logistics, but we want to just talk about their equipment on for the motorbikes and the vehicle. We could see that they have a robust motorbikes and also a branded cars for that. And therefore these cars will not be used for any other thing apart from sample referral. And that was very, very good. In some of our countries where we have vehicles for sample referral, you will see some of these cars being ended up in some directors' offices and their homes, but these ones were branded, and so therefore it makes it difficult for somebody to pick it, and that was very, very good. We also realized that some of the experiences we saw that the region had 4 strong, robust motorbikes, but this is just at one province that we went, and then the district, and then it cascades down to the lower level. They also had not just the sample containers being moved, but then detected to the sample, and therefore when there's even an accident.
Dr. Gift, your network is really bad on and off, and I request if you could hurry up a bit in the interest of time. We are really running out of time.
Okay, next slide, please. Yeah, so in terms of chain of custody and procedures, they had a barcoding system that could be optimized. They also had an excellent sample collection clinics and hubs, so they are using the hubs and spokes. And then also there's a laboratory system, information system that is being used to capture the data and also to monitor samples that are moving in and out. Next slide, please. So what are our takeaways concerning the sample referral? We realized that in Zimbabwe, they have a well-integrated sample referral system. That is very good. They also had a very good transportation system that involves both motorbikes, and then these are customized, and therefore it tells the hub and spoke to work very well. In terms of logistics, there was somebody who is really in charge, and therefore see to it that both from sample collection to motorbikes to everything is being well coordinated. And the one good thing that we saw was that because of that ownership, even at districts where they had some delays in fuel being sent to them for the sample IST, the districts would take the lead to provide those finances, and then they are reimbursed. And this was very good. And then that ownership, you could see it. Next slide, please. So for the LIS, we realized that it was also very centralized, and it was also coordinated, and it is owned by the government.
If you mind going to the final slide, how this you are implementing the lessons, that would be helpful, so that we give the floor to the next presenter. We are running out of time.
That is well noted. So please, can I? So for what are we doing after this peer-to-peer learning? I must say that for sample referral, this really helped us to get a very good action plan before we got to Ghana. And as a result of this action plan, we have been able to put an implementing plan, a well-documented implementing plan on how to use this sample referral and use it in our country. This has been shared with Global Fund, awaiting for their updates, and then also to know the way forward, whether what we have is what they want, and then we can proceed on that. And then the implementing plan has to do with our guidelines, our mode of transportation, logistics, coordination, and monitoring and evaluation. Thank you.
Thank you so much, Gifty. So with that, I want to welcome Team Zambia, and Dr. Doreen will be leading us through the Zambia presentation. Please, Doreen, over to you.
Thank you so much. I'm grateful to the Zambian team for this opportunity that they've given me to present on behalf of Team Zambia. Next slide, please. The next slide. I think I'll not go through this slide in the interest of time. Okay, I can go to the next slide. Sorry. Okay, I'll spend a bit of time explaining this particular slide, because this speaks to the objectives that we actually went to Uganda to learn the peer-to-peer learning on how to set up a malaria RDT scheme. The rationale is that as Zambia, these are discussions that we've had because of the challenges that we've been having with commercial PT providers. Challenges that look at the high cost of acquiring EQS services. Also, we've had challenges where we have delays in resolving some of the queries that arise from being utilizers of the PT schemes. And also, you find that in most cases, some of the tests that are relevant to our country are not really available. And so we thought that as a country, it was very important for us to set up our own in-country EQS scheme. Next slide, please. Next slide. National Lab Technical Working Group, and we had to share what we learned from Uganda. And it was very easy for us to convince the National Lab Technical Working Group, because there was a lot of demonstration that knowledge had actually taken place. There was a lot of knowledge transfer. There was also a lot of information that we brought from what we saw in Uganda. They've got an integrated system. And for us, I think when we presented to the Lab Technical Working Group, the need for us to integrate all our PT schemes that we are doing in country, it was very easy for the Lab Technical Working Group to actually approve that we go that direction. Issues of sustainability, I think I've talked about the challenges that Zambia has been having in terms of the cost of acquiring these PT materials from commercial providers. So this is something that was welcomed by the Lab Technical Working Group, and everyone was just excited to say, look, let's set our own, let's all have our, let's all put all the resources that we have and make sure that we set up a scheme and a program that is going to be sustainable, because the foundations were already laid from the malaria PT peer-to-peer scheme that we did. So it was like, let's start with malaria RDT production, and then let's build on the other tests that we need to do as a country. So after that was adopted by the National Lab Technical Working Group, we then had to do a protocol, and we submitted this protocol. We applied for a waiver to the University of Zambia Ethics Committee, because we needed to ensure that we secure the carryover samples that we needed to use to make these PTs. And also we needed to ensure that the protocols are approved by the National Health Research. So after we had the adoption from the National Technical Working Group, from the National EQA Technical Working Group in country, we had to make sure that all the procedures and the ethical procedures were actually approved before we could actually proceed. Next slide. Next slide. Then after that, we actually called a team, because 3 of us were trained in Uganda. We needed to train now the people that are going to be like trainers of trainers, and the people that are going to be involved in actually producing these panels. So 2 labs were identified. One of them is the National Malaria Elimination Center lab, and the other one was the child lab. So we identified 12 staff that we called on site, and we trained these people. We oriented them on how to produce the panels and all the steps that we had learned whilst we were in Uganda. And after this training, we also now started working on the protocol and all the SOPs and all the forms that we needed before we could roll out the program. Next slide. So after we had done the protocols and the documents, we needed to call this, because we first of all had to select the sites where we're going to pilot this, because it's a pilot. We just learned and we thought, okay, we can't go full scale. Let's see how we can be able to pilot and select just a number of sites in the country and see how the program is going to run. So we selected 10 sites per province, and we had a criteria that we are using to select these sites. So the criteria was what is the positivity of malaria in that province. Also wanted to ensure that the sites that we put on this program, we're going to leverage on the HIV PT scheme that is already running in country, and also looking at the geographical locations of the various sites where they were placed. So this was the criteria that we used. So we selected the sites, and after we selected the site, we called all the stakeholders in those selected provinces and sites to a meeting, and then we oriented them on how the program was going to run. We oriented them on the forms. We oriented them on how everything is going to run from central level right to the peripheral sites where the testing is going to be done. And this is what we did as a team. Next slide. Okay, so I put this roadmap just to show where we are from the time we are trained, which was just the third quarter, because after the peer-to-peer learning, we are all requested to submit action plans as mentee countries to our mentor. So in the first quarter, which was the training was it was in August and September. Of course, this was the visit that we did to Uganda. And then in the third quarter itself, immediately we came back, we started working on the documents and developing a framework, the site selections, and we plan to actually produce our first panels before the end of this year. So you can see how Zambia is very excited with the knowledge that we got from this peer-to-peer, because it was just in September when we had the training, but we've done almost everything. The next thing that we are supposed to do now is just enroll the sites and start producing the panels and ship them off before the end of this year, or maybe first week of January. So for us, I think we are very excited with this program, and we really appreciate that this peer-to-peer learning indeed is something that is sustainable. It's something that is very, very, very it's a program that we can all leverage on, because other than the interactions that we are having with our mentors, we are also having that interaction with fellow mentee countries that participated. We are in touch with Tanzania, we are in touch with all those other Ethiopia, the countries that we are together when we did the peer-to-peer. So it has served as a resource that we can all build on and leverage on. And in that case, it's also looking at what are the strengths that we have as Zambia and what are the strengths that other countries have. So we are able to exchange that knowledge, and we are very, very, very happy. We are very proud of this, because as I said, it's not only malaria. The next it will be syphilis, the next it will be hepatitis, and we'll not need any international TA at the rate at which we are moving. So for me, I think this is an excellent approach that has allowed us to effectively share knowledge, exchange best practices, and successfully implement a national PT program just beyond the malaria RDT program that we led. Thank you. Thank you.
Thank you so much, Doreen. We can really see the true spirit of peer-to-peer learning in Team Zambia, and thank you so much for the excellent work and presentation. Thank you also to Gifty and to all the earlier presenters. I know we are really strained of time. There are a few questions and comments in the chat box. Zioda, I need your guidance. If we need to run over by a few more minutes, I think we need to give room also to the attendees to ask any questions or comments. And also to all the peer learning participants, please feel free to type your experience from the exchanges on the chat box, because through those feedbacks as Global Fund, we are able to make in some corrective changes and improve on the quality of the peer-to-peer learning from the lessons learned. So
Thank you, Osborne. I would suggest we go through the questions on the slide, and for participants who can spare another 15 minutes, if they stay and engage in the conversation and discussion, that would be also welcomed and possible. Thank you.
Thank you. On the Q&A, the first one is more of a comment from Gatechu Aga. Most of us are saying sample referral, but it should be specimen referral. We are referring or transporting the specimen, not the sample. The sample refers the sample refers to what we are examining. We know these are terms which can be confusing and are always used interchangeably. So thanks, Gatechu, for them confirming and reinforcing on the right terminology. Question 2, anonymous. The name was not indicated from the individual raising this question. Has there been any follow-up visits to mentee countries from the mentors to support implementation? Zioda, do you want me to read through the questions, then responses at once, or they can give feedback after each question?
It's up to you, really, but I would suggest we go one by one.
Thank you. So to both Team Uganda and Team Zambia, can you please confirm if there has been any follow-up visits to the mentee countries following the mentorship exchanges that were held between August and September? Thank you.
For Uganda, we've had 2 virtual sessions with the mentee countries, and we've drawn a roadmap for the physical site visits, but we've had engagements with the mentee countries twice virtually. But we have a roadmap for physical visits to follow up here.
Thank you, Agrippa.
No, we haven't had any follow-up visits, but the engagements right now to see how we can plan to. Thank you.
Thank you, Agrippa. Just to add also from my side, the follow-up exchanges follows a 2-model approach. One, there's virtual follow-up mentorship approach, where they engage both online as well as through a WhatsApp group in order to ensure that all the implementation action steps are being adhered to and the mentee countries are making progress. Secondly, there's also a plan which will be commencing from January, where the mentor countries will be making follow-up visits to the mentee countries based on a work plan that will inform some of the key areas that they will be working with the mentee countries to support them, and that way they are able to make progress. So that is on the way and will be commencing from January. Then question number 2, again, name anonymous. One of the objectives of the peer learning was to accelerate implementation and fund absorption. Can any of the mentee countries share experience of improved implementation and fund absorption post the peer learning visits? So would want to hear a response from both Ghana and Zambia. Starting off, can we start with Zambia?
Okay, thank you. I think for Zambia, the issue of fund absorption, because this TA didn't come with any additional resources in terms of like actual money to the grant. So what we are doing is we are just leveraging on our existing resources that we have already in country. Because when we did the concept note, we had to link this activity to what the activities that are already approved within our grant. So I think the issue of absorption, it's not like there was an additional money that came. It was just to see how we can leverage with what is already approved in country. And I think for us, it's working well. We don't anticipate to have any issue with absorption. Thank you.
Thank you, Doreen. And to Gifty, any reaction from Team Ghana?
Yeah, so thank you very much. I think for Ghana, in terms of our absorption rates for LIS, after the peer-to-peer, it has helped us to move to the level where we've been able to secure the contract, and therefore we know what to do. So we are just waiting for that finalization of that contract for the vendor who has won to start. And so that is where we are. Concerning sample referral, we are now we've costed everything. We are now at the stage where we would agree with Global Fund, and therefore we can start implementing. Thank you.
Thank you, Gifty. We are not clear what you mean by agreeing with the Global Fund. Can you maybe elaborate to the participants?
Yes, so our funds were being held for us to get a clear lines of implementation plan for us to start on what to do. And so that after the peer-to-peer really gave us a heads up to know exactly what we wanted to do. And then that had been put and costed. So we are just waiting, and it's been shared with Global Fund. We're just waiting to get the feedback to see that this is the way forward, and therefore we can move. Thank you.
Thank you. And to all the dear participants, we'll be having an overrun in time. We'll be stopping at 15 minutes on top of the hour, so kindly bear with us. The fourth question, Team Ghana, beyond the lessons learned and action plans developed, what are the practical aspects of specimen referral systems and lab information systems that you have implemented in Ghana? And how is it creating efficient specimen referral system for better patient management and care? I think from the explanation you provided earlier, it partly alludes to this, and I don't think you need to also respond to that question unless you have anything more to add to the earlier response.
Yeah, Osborne, I think you are right. Exactly the status we are is what I have said, so the answers would be similar. Thank you.
Thank you. And the question number 5, whoa, I don't want to mispronounce the name. For the mentor countries, what are the most significant challenges you faced in adopting your successful laboratory practices to fit the specific needs of the mentee countries, and how did you overcome them? So maybe we start with Team Uganda.
Thank you so much for that question. I think my colleague mentioned the challenges. The first one was around translation, but we need to keep improving this because delivering the package as it was, we couldn't really deliver it right because of the translation challenges. So we need to keep improving that. But the biggest one, we found that the mentee countries were at different levels of implementation of the different systems. Yet we had a one-fit-all training curriculum that we had, the modules that we had come up with. So for the countries that were ahead, we had to take them back to the countries that were not very well ahead of their systems. So we had to have a common ground of starting on the training, which was, I think, which didn't go well with some countries that were already far ahead. So we had to adjust on that. But also the biggest other challenge we faced, or we think we continue facing, is the implementation of the work plans that we make the countries come up with, because the different countries have a lot of different approval processes. Some were expressing fear of having their top managements approve, then having no budgets and the like. So it's like coming up with an implementation plan, but somewhere like implementing it might not be possible because they had to go through a lot of processes and availability of the budgets. So I think as we continue with the peer-to-peer, maybe put in countries that are at almost the same levels in the same cohorts, it can help. But also finding out, doing a prior assessment on the availability and approval of some of the implementation plans for these countries, such that when we come up with an implementation plan, they are able to implement it. And when we go for follow-up, at least we see some steps being followed. So those were the main 3 challenges we faced. Thank you. There were other small ones, but we managed through. Thank you.
Thank you so much, Dr. Susan. Agrippa, anything to add?
Susan, you have taken away all my words. So in the interest of time, I think you have done justice to that question. Thank you, and over.
Thank you. Another question from Aigbe. I would like to know if any dashboard was developed to track specimen referral systems. Can Ghana go first, then Zambia? I think Zambia is not implementing SRS, so Team Ghana.
Yeah, thank you very much. There's no dashboard yet since we are yet to implement our implementation plan. Thank you.
Thank you. And can you confirm to the team that developing a dashboard for tracking of specimens is part of your action plans based on your engagements and the documents that you have prepared so far? Because that is a key framework document that would guide your next steps.
Yes, so it is not directly stated in there as such, but then we intend to use the integrated laboratory information system. But then there are monitoring M&E tools that we develop to do that. But we intend to link it to the LIS that we are also doing. Thank you.
Thank you. Question number 7 from Abu. For countries that have not yet started the implementation between MENTA and mentee countries, what is their fate? Is there any plan for these countries? So I would want to direct that question to Agrippa, Team Zimbabwe, noting in one of your earlier comments that there has not been very much proactive follow-up engagements with the mentee countries. So Agrippa, can you take on that one?
We believe, yes, there are some countries that have not started implementation. Why? Because we've not heard from them again. But there are some countries that have done begs to say how do we navigate this and so forth. There's some work going on there. And like I indicated before, I think there is need to reestablish the engagement between ourselves as the mentor countries and the mentee countries so that we touch base and get to hear what they are doing, if they're facing any challenges or if they are not interested in implementing, or if they're implementing, where are they? But from the engagements, it seems like all the 7 countries, they had some already approved funding, which they were ready to absorb towards specimen referral. So I think the first thing is to touch base with them, and probably if there are gross misgivings there, then probably this will be some of our target countries for the peer-to-peer visits, so that we strengthen their capacity and also help them break the hoodoo between the implementers and the policymakers. Thank you, Dov.
Thank you so much, Agrippa. We are at 5 minutes to the top of the hour, so I would want to take the remaining 2 questions very quickly. Congratulations to everyone for the excellent presentations. I would like to know who in the mentored countries manages the fleets and logistics that support the sample integrated transport system. And for Zimbabwe, how is the follow-up being provided to the countries? So I would request Agrippa again to respond to the 2 questions at once. So Agrippa, noting that question, I think I would highly encourage that you can have direct engagements then to Antonio. I would highly encourage if you can have direct engagements with Team Zimbabwe. And a final question, what criteria did you use to select transport service providers? What strategies have been effective for overcoming resistance to change from stakeholders? Are there tools or templates you would recommend to streamline implementation? So Ocean, thank you for those very 2 questions also. So I would actually recommend that both the questions from Antonio and Ocean, kindly if you can reach out directly to Agrippa of Zimbabwe, they would be very helpful in helping you to shape up some of these key areas you are raising. Then please, any specimen systems? Sorry, you deleted the last one. So I would suggest that for the remaining questions, engage directly with the presenters to help address some of those questions. And I would want to welcome Lyndon Morrison, the head of High Impact Africa 2 Department, to give us closing remarks. Otherwise, thanking everyone for the excellent presentation. Thank you.
Hi, good afternoon. Osborne, I'd like to thank you for what you said and thank everyone for the excellent presentation. And more importantly, to thank them for actually agreeing to stay an extra time. In earlier session, right, and when you were, many of the presenters thanked the Global Fund for making this possible. But I want to mention here that the Global Fund, we should be thanking you. You've demonstrated through this workshop, to what you've done so far, to this exchange visit, how we could very much leverage the talent in Africa, the talent across the region to really build something very, very strong, as was presented in the portfolio, in the presentations today. So more so I could do is continue to urge you to build upon this. I think someone mentioned, I think it was a Zimbabwean mentioned, that one of the challenges, it was better good interpretation, but more importantly, he mentioned, how can we keep the momentum going? So I urge us to continue to take some of these lessons on board, but I want to urge us to remember the call to keep the momentum going, challenge ourselves, challenge the Global Fund, so we can do much better, so we can go from strength to strength. I don't want to take much more of your time, but just to say really a big thank you for this once again. When Fatim and then the team brought this to the Global Fund, this was just seen as just another idea, but this has grown into something that we are very proud of and we are very committed to in the Global Fund. So as I want to, in closing, and my final word is to challenge us and let's go from strength to strength. So thank you very much for being here and thank you for sharing these wonderful experiences. Thank you.